Hello, you lovely medic. Now be a dear and listen up. Shortness of breath is one of the most common presentations for patients in GP settings and hospitals, with a plethora of reasons causing it. But panic no more and listen up as I guide you through some of the most common conditions causing it. Before you know it, a breathless patient will be like a breath of fresh air for you, if you will. Spiffing. Firstly, little cherubs, we're going to divide our shortness of breath into acute or chronic. It's a lovely place to start and will help you no end. Now, let's start with pneumonia. Patient normally presents with a productive cough, dyspnea, fever, rigors, and just general illness. It's most commonly due to a bacterial infection. And when you listen to their chest with your stethoscope, you'll find some crackles and hopefully some decreased breath sounds and some slightly duller percussion. Another acute shortness of breath problem is asthma. This normally presents with episodic wheezing as well as the shortness of breath and chest tightness. Most patients, many of which are young, usually have some kind of allergen exposure. When you listen to their chest this time, you'll hear an expiratory wheeze, and you should see them use their accessory muscles. Now, let's never forget the possibility of a pulmonary embolism in acutely dyspneic patients. They often also have chest pain and may have hemoptysis. Also, let's look for a hot swollen calf to suggest a DVT. When you examine them, they should be tachycardic, tachypneic, and hypotensive. So, now that's all those pesky acute causes of dyspnea out of the way, shall we take a look at some of the more chronic causes that you might encounter? Let us start with COPD. This patient normally presents with a chronic cough and worsening breathlessness, especially during exercise. Usually they've had some kind of smoking exposure, and it's actually a combination of chronic bronchitis and emphysema. When you examine these people, often have cyanosis and a hyperinflated chest, perhaps even with clubbing of their fingers. Let us not forget heart failure as a cause of chronic breathlessness as well. Patients often present with dyspnea, which is worse on exertion. They may struggle to sleep at night with paroxysmal nocturnal dyspnea and are also very edematous. If you listen to their chest, you'll hear fine crackles, see a raised JVP on their neck, and probably find some swollen ankles. Now, another little pesky cause of chronic breathlessness could be a pleural effusion. Patients often present with breathlessness along with pleuritic chest pain and a rather dull ache. This effusion may be exudative or transudative fluid. There are several causes behind this which I may suggest you go and have a quick look at after this. When you look at their chest, it might be asymmetrical, you might hear some dull percussion and even have some reduced fremitus. Now, last but not least is interstitial lung disease. These patients often present with a chronic dry cough and breathlessness that gradually gets worse. When you listen to their chest, you'll hear dry crackles, you'll probably see a little bit of clubbing on their fingers, and you might even see some cyanosis. In the past, they may have also exposure to certain materials, such as asbestos, or hay, or feathers. You see, now wasn't that all rather easy? What you need to do is follow those little bits of advice that I've just given you, and you'll have no problem with any breathlessness patient you should see. Feel free to visit this video again and use my top tips in this to go away and learn some more information from it. Thank you, little cherubs, and goodbye.